effectiveness, about 75%, seen in the early period after a booster dose, and very likely higher when it comes to hospitalization and severe disease. Next slide. A quick word now on something that Jeff mentioned, is namely the treatments that are available. Unfortunately, but understandably, with the degree of mutations that we have with Omicron, some of the monoclonal antibodies shown on the slide here very likely will not work against Omicron. And those are shown in the first two under monoclonal antibody. Fortunately, the GSK Vir product, sotrovimab, looks like it is well positioned to be used as a treatment against Omicron. And then the AZ product also is likely. Small molecule antivirals are available now. You heard the recent approval of an EUA of Paxlovid. Of note and underappreciated is remdesivir is already fully approved and is available in a 3-day course, which in a recent study showed to dramatically diminish the need for hospitalization. Guidelines on this will be now re-examined by the NIH Guidelines Committee, and you'll be hearing more about recommendations how to utilize these. If I can have the last slide. I want to again just reiterate what Dr. Walensky said about prevention, which is a multi-layered, comprehensive process, the hallmark of which is vaccination. Now, one of the questions that Dr. Walensky and I and Dr. Murthy and others get asked very frequently is that right now, as we get to the Christmas holiday and the New Year's, would it be safe for individuals who are vaccinated, who are boosted, to get together with family in the setting of the home? The answer to that is yes. An extra level of protection would be the testing that Dr. Walensky measured. But I want to make sure this is not confused with going to a large gathering. And there are many of these parties that have 30, 40, 50 people in which you do not know the vaccination status of individuals. Those are the kind of functions in the context of COVID, and particularly in the context of Omicron, that you do not want to go to. So to the extent possible, we urge you to stay away from those situations that could put you at a higher risk. I'll stop there and back to you, Jeff.
Well, thanks, doctors. With that, let's open it up for some questions. Kevin?
Thanks, Jeff. Let's try to get through as many questions as we possibly can. First, let's go to Peter Sullivan at The Hill.
Hi, thanks. I wanted to ask on the supplies of the new Pfizer treatment pill. There have been some experts calling for the administration to just do more to increase supply, for example, enlisting other manufacturers the way Merck is helping to make the J&J vaccine. So you're not just relying on Pfizer's capacity alone. Have you considered that at all, or is there more steps the administration can take to boost the supply?
Yeah, and I might also have Dr. Fauci talk some about the synthesis process, which takes months to do. We know the Pfizer team is hard at work ramping up production, and everyone agrees this is a very promising antiviral, and therefore we want to make sure that production is ramped up as quickly as possible. According to the company, the complex chemistry involved in creating the active ingredient in the pill means the production takes, as I mentioned, about 6 to 8 months. Now that the pill is authorized, we will have discussions to explore how we can help them improve their manufacturing capacity even further by providing any resources that they need. As quickly as Pfizer gets the pills manufactured and delivered, we will be immediately providing them to states and jurisdictions for distribution. So the bottom line is today is an exciting development, and we applaud the American company for their innovation. We do have 10 million doses ordered, which is the largest amount of any country in the world, and 265,000 treatment regimens will be available to us in January. Anything you want to add there, Dr. Fauci?
Well, Jeff, just what you said. I mean, the very good news is that we have a product now that has about a 90% efficacy in preventing hospitalization. But the sobering news is, unfortunately, it is really a quite complicated and complex synthetic process, which we will be working with the company to figure out how we can help alleviate the stress of the long duration that it takes to make it. And hopefully we'll be able to shorten that process by working closely with them.
Next question.
Tamara Keith at NPR.
Thank you so much for taking my question. I'm wondering, the WHO is telling people to curtail their holiday plans. Why isn't the U.S. government doing that also? And also, where is the CDC on modifying the definition of fully vaccinated to include boosters?
Dr. Walensky on holiday and modifying the definition.
Yeah, I think that you just heard from Dr. Fauci as to how we are recommending people modify their holiday plans. Certainly, we're not advocating for large events and so I think that this is a modification. We also have given clear guidance as to what we believe is a safe way to gather. We do want families to be together, to be able to be together this holiday season. And so to do so, we're really encouraging people to be vaccinated, to be boosted, and to practice all of those prevention strategies before they gather, so they can maximize the safety of their holiday gathering, as well as that reassurance of a test. With regard to your second question, our guidance right now is very clear. CDC strongly recommends that people who are eligible for a booster go get a booster. That is everyone above the ages of 16, boosting at greater than 6 months if you receive the Pfizer or Moderna vaccine, and of course greater than 2 months if you receive the J&J vaccine. We're looking at the definition right now, and more to come there. But just to be very clear, our recommendations are to get boosted.
Next question, please.
Go to Jeff Zeleny at CNN.
Thank you for taking my question. I was wondering if Jeff or the doctors could point to one thing in the last month that you could have done differently to avoid where the nation is right now on the cusp of Christmas.
Dr. Fauci, anything to add there?
Well, I don't think I can pick out one thing that we could have done. Anytime that you put the effort that we're putting in, we always are the strongest self-critics of, could we have done something better? Could we have done something more quickly or more thoroughly? And, when you say I can't think of anything, I don't want anyone to think that we think we've done everything perfectly, but I don't think I could point one thing out in the last month. I think we've been intensively involved in getting the response to the Omicron variant. We jumped all over it. All of us spent the entire Thanksgiving weekend getting enough information to be able to respond in an appropriate way to Omicron. So again, admittedly, we can always do better, but I can't think of something specifically that we would have done differently.
Next question.
Go to Meg Terrell at CNBC.
Well, thanks. Going back to the Pfizer drug, I wonder if you can walk through how patients should try to get this drug. The fact that they have to get a test result quickly and take the drug within 5 days of symptoms. A lot of folks don't have primary care doctors. So will there be telemedicine or some way to get it through the pharmacy? How do you look at that? And then with the sort of limited supply of it at the beginning, it is indicated just for high-risk people, but should there be prioritization even within those groups, like by vaccination status?
Why don't I talk for a second about the distribution plan and then over to Dr. Fauci for the medical questions. As we've done with vaccines and monoclonals, we'll distribute these treatments, these pills, in a fair and equitable way now that they've been authorized by the FDA. The antivirals will be provided to states and jurisdictions at no charge on a pro rata basis to quickly get that supply in the field. As I mentioned in my comments, as part of the administration's commitment to equity, we are also distributing antiviral pills, Pfizer, directly to federally qualified community health centers across all 50 states, and that will ensure that these life-saving antivirals are available in some of the most vulnerable communities and hard-hit populations across the country. Over to you, Dr. Fauci, for the medical part of this.
Yeah, well, Jeff, and it is obviously a very difficult situation when you have a limited supply. For that reason, we've asked the NIH Guidelines Committee to put together a recommendation of when someone comes in with an acute infection and is in a risk group, which is what you want this to be for, since we have a limited supply, that we would have a prioritization of what the best approach would be. It almost certainly will be a physician writing a prescription for someone who within the first 3 days of notable symptoms of COVID and is in a high risk group to get it. But those guidelines, which will not only be limited to what you would do with Paxlovid, but also whether or not might be more appropriate to recommend remdesivir, which can be given in a 3-day course, or one of the monoclonal antibodies that work. So stay tuned. This will be coming out shortly from the Guidelines Committee.
Next question, please.
Let's go to Ricardo at the AP.
Can you hear me?
Yep.
Yes.
Okay, thank you for taking my question, and it's for Dr. Walensky. And my question is, the president flagged that we're going to see more and more cases involving vaccinated people. In every workplace, he said, even in the White House. And anecdotally, people are seeing that with various political and sports celebrities who are vaccinated getting COVID. Can you tell us what proportion of cases currently are represented by vaccinated people? In other words, what proportion of COVID cases are vaccinated people? How that compares with what proportion of hospitalized patients and deaths? And can you give us a timeline for a decision on making the definition of fully vaccinated to mean boosted as well, because it seems like that's an urgent question for the average American.
Yeah, thank you for that question, Ricardo. So what I can tell you is that you are 10 times more likely to have a case of COVID if you are unvaccinated compared to if you are vaccinated and boosted. You are 20 times more likely to die of COVID if you are unvaccinated compared to if you're vaccinated and boosted. And yes, we know with Omicron that has more mutations and is able to evade our vaccines better, that we are going to see vaccinated and even boosted people have breakthrough cases. And they will have breakthrough cases with mild disease or perhaps even asymptomatic disease. And what I would say is that is those vaccines working and working well, because those vaccines are working to prevent really severe disease and to prevent hospitalizations and deaths. As for your second question, that evaluation is currently underway and more soon. But to be very clear, our recommendations are to get boosted.
Next question.
Go to Martin Grappi at USA Today.
I want to ask Jeff about the guidance coming out next month on how insurers will pay for at-home COVID tests. Does the administration have the ability to require health plans to work with the pharmacies to make these tests free to consumers at the counter so that you don't have to file for reimbursement after buying the test?
Yeah, so it's a good question. That's very much work in process, and all ideas like the idea that you mentioned are on the table, and that'll be worked through across the next couple of weeks with clear guidance on how American consumers with private health insurance can be easily reimbursed for their test. Next question.
Carol Stolberg, New York Times.
Hi, thank you for taking this question. This is directed at Dr. Fauci. Dr. Fauci, I wonder if you could address this idea that somehow Omicron is a blessing in disguise. A South Korean health official said Omicron could be viewed as a signal of this pandemic nearing its end if it is proven to be more contagious but less deadly. And I'm wondering, in the context of the data that you presented from South Africa today, what is your view of that?
Well, I think that's a supposition that might, I would hate to say a blessing in disguise. I never thought of a virus ever that can infect and kill people to be a blessing in any way. But if you're talking about, would it be preferable to have Omicron be totally pervasive and be relatively low degree of severity? Yes, obviously that would be preferable, but it's dangerous business to be able to rely on what you perceive as a lower degree of severity. Having said that, it is conceivable, Cheryl, that if Omicron takes over and you get a good immune response to Omicron and you do not wind up getting severity as much as with Delta, that we could wind up with a virus that's pervasive, that does not cause severity, and that people will get enough immune response to, that you would then wind up having a lesser degree of morbidity and mortality. That is conceivable, but you don't want to count on it. You can't count on anything when you're dealing with a virus that has fooled us so many times before.
Next question.
Last question. Let's go to Josh Wingrove at Bloomberg.
Thank you very much. Jeff, France said today that they're not going to use Merck's pill and are going to wait for Pfizer's pill. If the FDA does authorize Merck, will you use it? In other words, will you follow the FDA, or is there any review that would happen afterwards about whether one pill would be better than the other? And Dr. Walensky, we reported on the weekend that the data on vaccine counts are off nationally because of a range of factors, but essentially we're underestimating both the fully vaccinated and boosted, but also the unvaccinated. I'm wondering if you have any idea how big the gap is. In other words, do you know what the true number is? Thank you.
Well, obviously on the Merck antiviral pill, we will follow the FDA's lead. And as Dr. Fauci talked about, the NIH guidance on how the pill would be used if authorized by the FDA. And as I mentioned earlier, we have purchased 3 million of the Merck pills. Over to you, Dr. Walensky.
Yeah, thank you for that question, Josh. So we work with states, local governments, local jurisdictions, and work to get the best data that are possible from those local jurisdictions and compile the immunization data from many different places, from pharmacies, from healthcare providers, from large database, large electronic health records, and do so from all different states and jurisdictions. We work closely with those states and jurisdictions to update and provide us the best possible data that they can. And then we compile it to give you, the American people, the best reporting that we can. What I can say is that there's one better way to get the data better, and that is if people can bring in their vaccination cards, that really does help us to record what dose they are on. And when they are not able to provide those vaccination cards, it makes it harder for local jurisdictions to assess that. So we're working with local jurisdictions and governments and healthcare providers in order to do so. And we'd ask the American people to help us by improve our data by bringing in their vaccination cards.
The one thing I'd add there, Josh, is, as you said, there may be some situations where shots are misclassified. A first shot as a booster shot was, I think, an example you gave. But I think the top line number, 475 million total shots in arms administered, I think it's actually higher than that at this point, approaching 500 million. That reflects the total tremendous progress that we've made. And what we know most importantly is getting more and more people vaccinated, more people boosted is the most important thing to do. So I know CDC is making progress on the data, but that top line number approaching 500 million total shots in arms is very encouraging. We need to continue to grow that each and every day. So I want to thank everybody, and I hope everybody has a safe and happy holiday. Thank you.